Hey there, it's Dr. Jim, and I'm going to put on my geriatrics gerontological hat because the topic that I have for you today is senior care. And it's something that I've studied for 33 years. I've witnessed and experienced, and I've worked with interdisciplinary team members on this particular topic for a long time, and it is fall prevention. Fall prevention in senior care. We were born to fall. All right, first of all, that's our bottom line. That's our starting point. We fell as children, we fall as athletes, we fall when we're not paying attention, we fall when we're drunk, and we fall as we age and develop neurodegenerative, muscular, skeletal, spinal conditions, and as we become frail with age and multiple comorbidities. So it's an important topic. We're all going to fall, okay? So falls increase with age. We know that. And more often than not, they're occurring in skilled nursing facilities than any other setting out there. So despite good care that the nursing facility is providing, and I am throwing no skilled nursing building under the bus. I've been in hundreds and hundreds and hundreds, and they do their best. Most of them do their best to provide great care, good quality of life, and a lot of supervision so that nobody's falling. Despite all of that, falls appear to be inevitable because the cards are stacked against us. Advanced age, frailty, cognitive decline, medical complexity of so many older and elderly nursing home residents across the country. Falls must be taken seriously because they are a leading cause of death among seniors in the United States. They're a leading cause of poor quality of life and multiple morbidities and physical problems. Because of this, careful attention must be provided to the causes of falls and effective methods to reduce or prevent them. And that's what this short video and this article is about. Share the video with your friends and your colleagues. Share the article, whatever you want to share. Make sure other people see this. So let's do some stats by the numbers. Falls are so common and serious among older adults and seniors that they're tracked and they're monitored by various organizations here in the United States and around the world. For instance, the World Health Organization reports that between 30 to 50% of people 65 years of age and older have at least one fall every year, and another 40% are repeat fallers. Yes, that's actually a term, a faller. Skilled nursing communities around the United States have a fall rate. That's why this is so important to talk about in skilled nursing care. 3 times higher than the community setting if the senior was living at home alone or in, for instance, in assisted living. But you have to think, skilled living, more medical complexity than an assisted living facility. Although we might want to look on memory care units to get a more accurate number. So it's reported that over half of nursing home residents fall more than one time every single year. Okay, a fall is a fall is a fall. Wrong. There are consequences, a lot of consequences to falls. Obviously, a fall can cause physical impairment and injury, but many times it's not the fracture, it's not the bruising that causes the most problems for seniors. It is instead the psychological and the emotional effects of falling that place very great burdens on the senior, including depression, anxiety, a fear of falling again. That is a real serious clinical syndrome, fear of falling, a loss in confidence, isolation, and withdrawal, and a general decrease in quality of life. So beyond physical and emotional consequences, there is a steep economic burden. I don't want to throw money into it, but just for a second, to the healthcare system through longer and more frequent hospital stays. Okay? Physical suffering, emotional suffering, financial loss. Here are three major causes, I'll call them clusters or categories of falls in senior care. Any number of factors can lead to increased falls or risk for falls in skilled nursing or, to be honest, any other setting. Such risks can be grouped into three categories, namely intrinsic or internal factors, extrinsic or external environmental factors, and behavior-associated factors. In general, to be honest and realistic, falls probably occur due to a combination of all of these factors, making interventions even more challenging. Okay, let's look at each one of these categories. We'll start with intrinsic factors. These include things like illnesses, diseases, disorders that the older adult has been diagnosed with, along with factors like advanced age and cognitive decline. You add those up, and they become the perfect storm for fall risks. Number two, extrinsic or external factors outside of the individual. Okay, these are found in the person's environment, most likely the immediate environment, including their room, the hallway, common areas throughout the nursing center. Another external variable of importance is the type and number of medications the individual has been prescribed. We all know this, well-known knowledge. Many medications come with risk factors, including things like fatigue, lightheadedness, and dizziness, which, again, can all lead to falls. Third, behavioral factors or variables. These include things like impulsivity, related to psychiatric illnesses like psychoses, schizophrenia, and so on, or an over-reliance on assistive devices, canes, walkers, wheelchairs, so on and so forth, due to an extreme fear of falling. Either way, the experience or illness that underlies a behavior can be a root cause of falls that should be identified and addressed in the plan of care. And I say plan of care, care plan, care pathway, so on and so forth, because we're specifically talking about an individual who most likely is living in a skilled nursing facility. And I continue. It's not as short as I thought, I'm sorry. Fall reduction and prevention strategies, isn't that what you came for? Because the rate and negative consequences of fall are significant, especially in skilled nursing facilities, reduction and prevention programs and interventions are not only greatly needed, but they need to be successful. In other words, it's not enough to simply have fall prevention programs or something nice on paper or in the computer, the medical record. What is needed most are effective programs that will either reduce the incidence of falls or prevent them altogether, and for the majority of residents living in a nursing home. Effective fall prevention strategies are methods or techniques implemented by staff, and they include the following. And this is just a handful. Fall audits to determine the scope of the problem. How many people are falling? What are the injuries? How frequently? What are our interventions and follow-up? Second, training and education, so very important. Third, environmental modifications throughout the building to reduce risk of falling. Fourth, establishing a fall committee that really seriously looks at data and then does something with the data. How effective are these interventions? Well, according to the research and the studies and everything else that I've looked at, methods such as these can indeed reduce the number of falls among residents who have never fallen, as well as those who fall frequently. Training and education, this is a huge takeaway from this video, appear to be the most effective strategy in reducing falls, followed by exercise with a balance component that residents are engaging in. And let's not forget about vitamin D. Vitamin D, years ago, we didn't think it was a big deal. Now vitamin D is almost on every resident's chart and med pass. Vitamin D supplementation can also reduce the rate of falls. Now, here's some barriers, and then I'm going to stop. Sometimes fall programs can only be successful as the employees who are implementing the interventions. Okay, that's important. This involves identifying and removing any barriers that might impede success. Such barriers include, I hate to say it, inadequate staffing, working short, heavy workloads, staff stress, burnout, poor training, poor communication among care staff, and frustration from the staff with the effectiveness of the fall program that they've been using. So, to maximize the effectiveness of any fall program, management, please, you must identify anything that gets in the way of a fall prevention program's success and improve it or eliminate it. Anything that gets in the way. All right, so here are my final thoughts, and we're going to shut this video down because I'm long-winded today. I'm sorry. Just one of those days. I'm a gerontologist. I've been in the field now for 3.5 decades, and falls are massive. Besides so many other problems that do occur in long-term care, skilled nursing in particular, falls are a big one. Falls have to be taken seriously. Seniors sometimes die because of a fall, or their quality of life significantly reduces so they just sit and they don't move. And when you don't move this old body, you're going to end up with a lot of other complications. So, good management, please take a look at your fall program, fall prevention program, and see if it's adequate, if it's effective, and if it's not, brush it off, tear it apart, and try to put something more effective together. I know it takes time and effort, and you have to look at data, but that's why we're here. If we're going to be ethical and we're going to deliver the care that we promise, let's do more for fall prevention. I'm Dr. Jim. Keep coming back because I'm never done researching. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description and keep coming back for more information. I hope to see you soon.